Let's talk policy. I'm Roberta Lavin, and I will be teaching the course this semester. I think it should be an exciting time for all of us to explore healthcare policy. There is absolutely no doubt that in the last 10 years it has been ever changing, and that in the coming 10 years it will continue to change just as rapidly. It is your responsibility as a healthcare provider to understand the policy and to help influence it. In this course, we are going to leave the class understanding healthcare policy. You're going to know how to do a policy brief, and you're going to know how to do a policy analysis, and you will practice both. We are going to analyze legislation, and we're going to learn to look at it critically. Specifically, you're going to learn to not just read what was written in a newspaper, but you're going to learn to read the professional literature about policies and to actually read pieces of legislation and to try to understand how they're written, why they're written, and what they mean. And that sometimes what is written in the legislation and what ends up being interpreted in the rules and the regulations that follow seem a little bit disconnected. And then finally, each of you is going to write a paper, a policy analysis of your own from a list of topics that I will give to you. And part of that policy analysis paper is to consider the ethical issues involved. Module 1 begins in this very first week largely with an orientation to health policy and what it is. I like to joke that you're halfway there just by being in the orientation. And I say this because when you come into any class, it's in many ways just like going to the gym. Half of the effort is actually putting on the clothes to go to the gym and walking through the door. Once you get to the gym, you rarely look at the equipment and say, oh, yeah, I'm not going to do this today. I'm just going to turn around and go home. You actually work out. Well, it's the same thing with a class. Half of the effort is showing up, and once you show up, you generally do the work and make it through the class. In this first week, uh, you're going to have a discussion question that's fairly straightforward. It asks you to think about how policy has impacted your practice. And almost every single one of us that has practice can tell you multiple ways in which policy has impacted our practice. And usually you can do that within only 6 months of actually having your first clinical position. By the time you get to the second week of Module 1, I'm going to ask you a little bit more difficult question, which is what's the status of the U.S. healthcare system and how do the expenditures impact it? So let's talk a little bit about the syllabus. The syllabus is online for you. It provides an outline of the expectations, but it isn't set in stone. Tell me what your concerns are. Is there anything you wanted to learn that you don't see in the syllabus? Just because I haven't included articles about what you're interested in doesn't mean that we can't add them or that we can't adjust. If a significant number of you want to learn something that I haven't included, then we can flex and we can get you what you need. We will use stories about APRN scope of practice as independent practitioners as examples throughout the semester, just because they're really clear policy examples for most nurses, even nurses who their intent is to be researchers or academics rather than being expert clinicians or advanced practice nurses. So their expertise may be in research, Whereas the doctorate of nursing practice, your expertise is going to be in clinical practice. Either way, the APR and scope of practice issues occurring across the country are significant examples, and they're very clear to us as nurses. We're going to explore how one action, such as limiting scope of practice, can impact the ability to independently implement other policies. And then you're going to leave the course being able to make policy and to defend policy. So please read the syllabus carefully and be fully aware of the expectations, assignments, due dates, and grading. The key assignments are the policy analysis paper, the discussions, the student-led presentations, and there are quizzes. The quizzes are mastery quizzes. They're to make sure that you understand the content. You can take them multiple times. The scores do count, but you can take them multiple times. What I'm most concerned about is that you do the reading and that you understand the reading. It's my firmly held opinion that there is little in life that we do that is more important than reading extensively, and especially about the area in which you practice. So let me clarify a few of the assignments because perspective does matter. Discussion board assignments are required and occur in different formats. Some of them will be the typical discussion board questions that anybody that's done online education has had. Some of them will be on a Facebook page I set up, and some of them will just be quick little Twitter chats. And I set these up in these different formats for a specific reason. You have to be able to explain information to people in multiple ways. There are going to be the occasions when you can have a detailed academic discussion with someone about a policy. And if you are in a situation where it's your responsibility to explain the pros and cons of the policy and to justify why you're making the recommendation that you are making, then you need to be able to do that in some detail with some very technical language, and you need to be able to make your case. However, it's not enough usually to just convince the people who are sharing the practice with you or the people who already share your views, but you generally, to change policy, you have to convince the general public, because major policy changes occur through legislation, and legislation doesn't generally occur if you can't tell a good story that can allow the representatives to support the legislative change. So you have to learn to tell a good story, and sometimes that means you tell it in 100 words on social media. And sometimes it means that you tell it with 144 characters and an attached article that makes your point. Lest you doubt that social media has influence, all you need to do is look around the country at the things that have changed in this country and around the world in the last 5 years as a result of social pressure that comes from social media. Being able to express yourself clearly and concisely is important. You will notice that when you start looking around at policy sites, that almost every government office now has a Twitter feed. So you also need one. We will have Twitter chats. We will use the hashtag health policy. If you don't want to use your actual name for the Twitter chats, I'm going to put a sign up sheet. You can sign up and you can tell me any account name you happen to set up, and it doesn't have to be associated with your name. I will be the only one that sees that, so I will know what your username is, and you can feel free to use that as long as I know it. The learning modules each come with lectures, notes, videos, and articles or website links. Not all the lectures are like by me. So one of the things I like to remind people in a class is that when you're doing face-to-face classes, you will frequently have guest lectures. And that's somebody that comes in from the outside that's an expert, and they give you a lecture. In online learning, it's this amazing opportunity to embed talks and lectures from not only nationally recognized experts, but internationally recognized experts. And I will use those because you don't need me to tell you about how the Affordable Care Act was written and the rationale behind it when you can actually get online talks from the people that crafted the legislation. And so I will link you to information like that. Again, the discussions are going to vary from less formal to more formal. You will have some that are on social media, and you will also have some that are on the actual discussion board. You may also get feedback from other people that join the conversation. So if we're having a Twitter chat and people from the outside join in the conversation, any reply to them counts. It doesn't have to just be a reply to a classmate. But here's the rule. You must always be professional and you must always be polite. Even if someone in the outside is being rude or obnoxious, uh, you still need to, as part of this class, be polite to them. One of the things that we will be using in this is the ability to communicate compassionately with other people. When you're making policy, people need to want to talk to you. So if we're harsh or if we're rude or if we're overly arrogant, then eventually people quit talking to us. They also quit listening to us. So we want to display all the professionalism we hope to see from others. And the last piece of why would I do some of this with social media? When you're learning health policy, you really do need to understand what other people think. And sometimes, as healthcare providers, we become a rather closed community, and we don't want that to happen. So, policy gives your work impact. This class is going to provide you with the tools and skills to give your work in your DMP or your PhD program impact. The ability to influence policy helps you to control your own future, to drive the agenda, and to change policy that can make your research have greater impact and address practice issues that limit practice or adversely influence quality of care. It's my pleasure to welcome you, and I look forward to our time together. Let's learn how to make the world the beautiful place that we want to photograph, the beautiful place we want to live in. And let's learn how to influence policy so that we can change practice. Thank you.